Today we are going to discuss about iodide, its deficiency disorders and its action of mechanism. Iodide is traces of the iodine ions are indispensable to the life. In the GIT tract, iodine from foods become iodide. Iodide occurs in the body in minuscule amount, but its principal role in the body and its requirement are well established. Human life is not possible without iodine. Iodine is an essential part of thyroid hormones which regulate metabolism. Thyroid hormones affect essentially the entire body and must be in the correct range for good health. The same is true for iodine. It must be in the correct range for good health. There are some indications that iodine has other specific function. None of these can be as critical as the actions of thyroid hormone. Iodide is an integral part of the thyroid hormones that regulate body temperature, metabolic rate, reproduction, growth, blood cells production, nerve and muscles function, and more. By controlling the rate at which the cells use the oxygen, these hormones influence the amount of energy released during basal metabolism. No question that iodine is essential, primarily as a result of its contribution to thyroid hormone. Evidence is accumulating that iodine may do other things. It concentrates not only in the thyroid gland but also in the breast tissues, eyes, stomach lining, uterine cervix, and salivary glands. Iodine may have a role in treating memory dysplasia, which is the abnormal breast tissues, and fibrocystic breast disease. It may be able to inactivate bacteria and increase the immune response. When levels are low, there may be a higher risk of stomach cancers. It seems possible that different forms of ingested iodine may preferentially go to different areas in the body. Molecular iodine, that is converted iodide, is most beneficial for the thyroid gland. Iodine may have more active on breast tissues that reduces the atypical cells. In breast tissues, iodine actually reaches 4 times the concentration it does in the thyroid. The breast tissues has two enzymes to control the amount of free iodine, which is higher during puberty, pregnancy, and lactation. There have been a number of studies using the various forms of iodine to treat fibrocystic breast disease. Iodine seems to decrease the symptoms of fibrocystic breast disease without harming thyroid function. There is evidence that iodine plays a role in preventing breast cancer in areas with higher iodine consumption, such as Japan. The incidence is much lower than in areas with low iodine intake. The breast tissues of women with the breast cancer contains less iodine than women without cancer. It has been hypothesized that the protective effect of multiple pregnancies on breast tissues may be because of the increased iodine in breast tissues during pregnancy and lactation. Iodine levels and breast cancer can inhibit mammary cancer. Human trials will be needed to try and confirm the iodine's effects on human breast cancer. In a study, a smaller number of women with the metastatic breast cancer whose initial tumor expressed the sodium symphotor were given iodine radioisotopes, and in one patient, the radioisotope was concentrated in a metastatic lesion. This shows that it is possible that some breast cancer's metastasis could be treated with radioisotopes of iodine. Radioisotopes of iodine are already used as part of the treatment for thyroid cancer and metastasis. Iodine is also an antioxidant. Iodine is converted to iodide using hydrogen peroxide, an oxidizing agent. When iodine is converted, it may decrease the damage by free oxygen radicals in the area. This may play a role in immune function. The hypothalamus regulates thyroid hormones production by controlling the release of the pituitary's thyroid stimulating hormone. With iodine deficiency, thyroid hormone production declines and the body responds by secreting more thyroid stimulating hormone in a futile attempt to accelerate iodide uptake by the thyroid glands. If a deficiency persists, the cells of the thyroid gland enlarge so as to trap as much iodide as possible. Sometimes the gland enlarges until it makes a visible lump in the neck, a simple goiter. Goiter afflicts about 200 million people the world over, many of them in Asia, Africa, and South America. In all but 4% of these cases, the cause is iodine deficiency. As for the 4%, which is the 8 million people, most have goiter because they eat excessive amounts of food that contain an antithyroid substance, goitrogen, whose effect is not counteracted by the dietary iodine. Goitrogen is a substance that enlarges the thyroid gland and causes this toxic goiter. These substances occur naturally in the such foods such as cabbage, Brussels sprouts, cauliflower, broccoli. The goitrogens present in plants remind us that even natural compounds of food can cause harm when eaten in excess. Goiter may be the earliest and most obvious sign of iodine deficiency, but the most tragic and prevalent damage occurs in the brain. Children with even a mild iodine deficiency typically have the goiters and perform poorly in schools. With treatment, mental performance in the classroom improves. Normal growth and development are major manifestations of most iodine deficiency disorders. Goiter, mental retardation, and cretinism. Childhood mortality is increased and normal reproduction is decreased. When insufficient iodine production, the thyroid gland enlarges while trying to make more hormones. Over time, it can develop nodules and even cancer. Organizations World Health Organization makes the recommendations and give assistance to countries where needed. In many countries, it is a large public health problems. Many breastfeeding women do not have even iodine in their milk for their newborn. In one study done in Boston, 47% of lactated women did not have enough iodine in their milk. Iodine deficiency may not always be suspected because of the use of iodized salt. A woman with an enlarged thyroid, low thyroid hormone, and a thyroid scan showing uptake of radioactive iodine is usually deficient in iodine. This can be confirmed by a 24-hour urine iodine level. Pregnant women not getting enough iodine will have slightly enlarged thyroid glands with low thyroid hormones and high thyroid stimulating hormone. If this continues through breastfeeding and afterward, they can become hyperthyroid and develop multinodular goiter. Without enough iodine, women may become obviously hypothyroid and have trouble becoming pregnant and carrying a normal pregnancy to term. Smoking significantly lowers the amount of iodine in breast milk. This is thought to occur because chemicals in cigarette smoke inhibit the activity of the iodine symbiote. If breastfeeding women do not stop smoking, they should take extra iodine. Low iodine levels are associated with thyroid cancer. They may also increase the risk of breast, ovarian, uterine, and prostate cancer. Iodine consumption can be as high as 10 times. It has been postulated that this may be one of the reasons for a lower rate of breast disease and breast cancer worldwide. There is also less autoimmune thyroid disease. A severe iodine deficiency during pregnancy causes the extreme and irreversible mental and physical retardation known as cretinism. Cretinism affects approximately 6 million people worldwide and can be avoided by the early diagnosis and treatment of maternal iodine deficiency. A worldwide effort to provide iodized salt to people living in iodine deficient area has been dramatically successful. Cretinism occurs when a growing fetus is low on thyroid hormone. In addition to severe mental retardation, it also includes deafness, mutism, spasticity, and short stature. In some parts of the world, as many as 1 in 10 people are cretins. Groups with iodine deficiency have an average 13.5-point lower IQ score than that of population with normal iodine intake. With insufficient iodine, the thyroid gland enlarges while trying to make more hormone. Iodine deficiency can occur anywhere in the world. In the worldwide, some salt is iodized with potassium iodide, but the use of iodized salt is option. In the Canada, all salt is iodized. There is iodine deficiency in Africa and Asia, and also in some parts of Europe, such as Germany. In many countries, it becomes a larger public health problem. World Health Organization makes the recommendations and gives assistance to countries where needed. Iodine is well absorbed from the gastrointestinal tract in most forms. Much of iodate form, which is often added to the salt, is converted to iodide. It was believed that most of the iodine goes to the thyroid or kidneys. It is concentrated in the thyroid, excess is excreted by the kidneys. Iodides, as opposed to molecular iodine, are absorbed via the sodium iodide symporter. The symporter is present in all the parts of the body that concentrate iodine, including the breast, salivary glands, thyroid glands, and cervix of the uterus. In the thyroid gland, iodide is made into thyroid hormone, thyroglobin, a large protein made by the thyroid cells, is necessary for the production of thyroid hormone. At the thyroid cell surface, iodide and the thyroglobulin meet. Iodide is oxidized and attached to thyroglobin to produce precursors of thyroid hormone. The precursors are combined into two different forms, tetraiodothyronine and triiodothyronine, which is T3. There is always thyroglobin containing iodine in thyroid follicles. This thyroglobulin is about one-third thyroid hormone and the rest precursors. A normal amount of iodine in the thyroid gland is about 15 mg. When thyroid hormone is needed, enzymes digest thyroglobulin to release thyroid hormones. Iodine that is not released as thyroid hormone is recycled within the gland itself. T3 and T4 travel in the bloodstream, bound to other proteins such as thyroxine binding globulin. When they reach the area needed, T4 is turned into T3. This means removing an iodide which returns to the circulation. T3 is the active thyroid hormone. TSH, also called thyrotropin or thyroid stimulating hormone, regulates the release of thyroid hormone. TSH is made in the pituitary gland when thyroid hormone level drop, and it stimulates the thyroid to make more hormone. When levels rise, TSH goes down. If there is not enough iodine, there will not be enough thyroid hormone made. TSH levels will rise, stimulating the thyroid. This causes the thyroid to enlarge. It can become a diffuse goiter or it can contain nodules. The excess TSH does not usually cause increased hormone with iodine deficiency. But sometimes, if there are pockets of iodine, there can be temporary hyperthyroidism with low iodine. Thyroid hormone is the major regulator of the body's metabolism. When it is low, everything slows down. When it is high, everything speeds up. Thyroid hormone is needed for normal development of the central nervous system. It is necessary for myelination, which is the covering of the nerves. Iodine deficiency disorders, which occurs throughout the world, wherever iodine intake is low, occur as the result of low thyroid hormone production. from inadequate iodine. There can be short periods of hyperthyroidism, but usually thyroid hormone levels will be low. It is now appreciated that iodine goes to other tissues, whereas there is 15 mg of iodine in the thyroid, there may be 30 to 50 mg in the body. Possibly less than 30% of the iodine is in the thyroid. Iodine goes to the eye, the stomach lining, and as noted, breast, salivary glands, and uterine cervix. Its primary role in the breast tissues has to do with the lactation. It is not known what the function of the iodine is in the other areas. There is a sodium iodide importer in the thyroid cancer cells, as well as, by some estimates, more than 70% of breast cancer cells. Iodine is used to prevent and treat iodine deficiency. Where iodized salt is available, that is the most common way to deliver iodine. Iodinated oil is used in countries where there is severe deficiency and medical resources are stretched. The oil contains a large amount of iodine, 400 mg per dose, and is enough for a year. Supplementation is important in known areas around the world where food is low in iodine. It is especially important during pregnancy and lactation. Molecular iodine can be used to treat the symptoms of fibrocystic breast disease without affecting the thyroid gland. Radioactive iodine is used to treat thyroid cancer. The Food and Nutrition Board of the Institute of Medicine has set dietary requirements for iodine. The following are the guidelines for iodine intake. The average intake for iodine is 110 microgram a day for infants 0 to 6 months of age. At 7 to 12 months, the average intake is 130 microgram a day. The estimated average requirement for children ages 1 through 8 years is 65 microgram a day. The recommended dietary allowances is 90 microgram. For children ages 9 through 13 years, the estimated average requirement is 73 microgram a day. The RDA is 120 microgram a day. The EAR for both boys and girls ages 14 through 18 years is 95 microgram of iodine. The RDA is 150 microgram per day. The recommended dietary allowances for all adults, except pregnant and lactated women, is 95 microgram a day and the RDA is 150 microgram a day. The estimated average requirement for pregnant women is 160 microgram a day, regardless of the woman's age. The RDA is 220 microgram a day. The estimated average requirement for lactating women is 209 microgram a day. The RDA is 290 microgram a day. Most people worldwide, but not all, get enough iodine in the diet. In many parts of the world, that is not true. It is also not true for the some people in certain parts of the world. It is important for the pregnant women to take enough iodine throughout the entire pregnancy and breastfeeding. Ingestion of multiple grams of iodine at one time can cause acute poisoning. A very large amount of iodine source causes fever, abdominal pain, burning of the mouth, throat, and stomach, nausea, vomiting, diarrhea, heart problems, and coma. Over the long term, both excessive and inadequate intake of iodine can cause thyroid problems. Depending on previous intake of iodine and any underlying problems with the thyroid. People with the thyroid or autoantibodies, meaning they are making the antibodies against their thyroid gland, are more susceptible to the problems with both excessive and inadequate intake of iodine. Excessive iodine ingestion can cause hyperthyroidism, the opposite of low thyroid. It can also cause goiter, thyroid inflammation, and thyroid cancer. Long-term consumption of excessive amounts of iodine may also cause hypothyroidism. This can happen at any stage. The reaction of a person's thyroid to excess iodine may depend on his or her previous level of iodine and any existing thyroid disease. There is a serious illness highlighted by a rash specific to high iodine intake called ioderma. The rash can look like acne, hives, or may be red or itchy. Ioderma can actually lead to death. The first measurable change with excess iodine consumption is an elevated TSH. TSH values were used to help set safety limits. The no observed adverse effect level for adults is 1000 to 1200 microgram per day. The lowest observable adverse effect level for adult is 1700 microgram a day. The upper limit for adult is 1100 microgram a day. This is the upper limit considered to be completely safe. Infant should only get iodine for breast milk, food or formula. The upper limit for other ages has simply been extrapolated based on size. The upper limit for children 1 to 3 years of age is 200 microgram a day. The upper limit for children 4 to 8 years of age is 300 microgram a day, and for children 9 to 13, the upper limit is 600 microgram a day of iodine. People who have autoimmune thyroid disease may be more susceptible to problems from increased iodine intake. There are common conditions, especially among the older women. One called Graves' disease is associated with hyperthyroidism. Another called Hashimoto's thyroiditis is associated with the hypothyroidism. In addition to iodine in supplements, iodine is contained in some medications, for example, amiodarone. It is also contained in disinfectants like providine iodine and in some contrast media used for X-ray studies. Molecular iodine does not cause the same problems as iodine and larger amount may be tolerated. The ocean is the world's major source of iodine. In coastal areas, seafood, water, and even iodine-containing sea mist are dependable iodine sources. The amount of iodine in the food is variable and generally reflects the amount present in the soil in which plants are grown or on which animals graze. Land masses that were once under the ocean have soil rich in iodine. Those in flood-prone areas where water leaches iodine from the soil are poor in iodine. Average consumption of iodine exceeds recommendation, but falls below toxic level as well. The baking industry uses the iodates as dough conditioners, and most dairies feed cows iodine-containing medications and use the iodine to disinfect milking equipment. Now that these sources have been identified, food industries have reduced their use of their compound, but the sudden emergence of this problem points to a need for continued surveillance of the food supply. The recommended intake of iodine for the adult is minus point. The need for iodine is easily met by consuming the seafoods, vegetable grown in iodine-rich soil, and iodized soil. Iodine is an essential part of the human diet. In many parts of the world, iodine deficiency is a major public health problem. In places where salt is iodized, most people get enough iodine. However, for people who are restricting their salt intake or electing not to take iodized salt, deficiency is a possibility. Iodine is especially important during pregnancy. Pregnant and breastfeeding women have an increased need for iodine. If it is not met, there are consequences for both the mother and the baby. The normal development of the fetus cannot occur without enough iodine. Iodine deficiency causes hypothyroidism and goiter. Anyone with low thyroid hormone and an enlarged thyroid should consider whether or not he or she is getting enough iodine. A 24-hour urine test for iodine can be done to check, but this is not common practice. People with autoimmune thyroid disorder may be less tolerant in the case of iodine excess. Iodine can help lessen the symptoms of fibrocystic breast disease. Molecular iodine is the form of best used to treat breast symptoms. It is found in the seaweed. Radioactive iodine can be used to treat thyroid cancers and metastasis. It is being investigated as treatment for breast cancer and its metastasis. Now, let's take a look on magnesium. Magnesium is a naturally occurring mineral. It is the fourth most common mineral found in the human body. Half of the magnesium in the body can be found in the bones. Almost all of the rest is in the body's organs and tissues, with only 1% of the total in the blood. There are mechanisms to keep the blood level of magnesium constant. This is important because magnesium is involved in at least 300 biochemical reactions. Magnesium is involved in muscles contraction and relaxation, the production as well as transportation of energy, the production of protein, and the function of hundreds of enzymes. Even though a significant percent of the people, perhaps as high as 20%, do not ingest enough magnesium, it is not measured during routine blood tests. Magnesium is barely qualifies as a major mineral. About only 1 ounces of the magnesium is present in the body of a 130-pound person. Over half of the body's magnesium is in the bones. Most of the rest is in the muscles and soft tissues, with only 1% in the extracellular fluid. As with calcium, bone magnesium may serve as a reservoir to ensure normal blood concentration. Magnesium acts in all the cells of the soft tissues, where it forms part of the protein-making machinery and is necessary for energy metabolism. It participates in hundreds of enzyme systems. A major role is as a catalyst in the reaction that adds the last phosphate to the high-energy compound ATP. As a required component for ATP metabolism, magnesium is essential to the body's use of glucose, the synthesis of protein, fat, and nucleic acid, and the cell's membrane transport systems. Together with calcium, magnesium is involved in muscle contraction and blood clotting. Calcium promotes the processes whereas magnesium inhibits them. This dynamic interaction between the two minerals helps regulate blood pressure and the functioning of the lungs. Magnesium also helps prevent the dental caries by holding calcium in tooth enamel. Like many other nutrients, magnesium support the normal functioning of the immune system. Magnesium maintains normal nerve and muscle function. It helps perpetuate a normal heart rhythms. It is involved in keeping the bones and the immune system strong. Magnesium is thought to help regulate blood sugar and is involved in keeping the blood pressure normal. It is involved in the synthesis of protein and energy metabolism. Magnesium may be useful in preventing or treating the high blood pressure, diabetes, and cardiovascular diseases, as well as many other conditions. Oral supplements may be useful for the people who do not get enough magnesium in their diet. Many of the potential uses of the magnesium are in medical, hospital settings. Even with average magnesium intakes below with the recommendations, deficiency symptoms rarely appear except with disease. Magnesium deficiency may develop in cases of alcohol abuse, protein malnutrition, kidney disorders, and prolonged vomiting or diarrhea. People using the diuretics may also show the symptoms. A severe magnesium deficiency causes a tetany similar to the calcium tetany. Magnesium deficiencies also impair central nervous system activity and may be responsible for the hallucination and experienced during the alcohol withdrawals. Magnesium is critical to heart functions and seems to protect against hypertension and heart diseases. People living in the area of the country with hard water, which contains high concentration of calcium and magnesium, tend to have low rates of heart diseases. With the magnesium deficiency, the walls of the arteries and capillaries tend to constrict, a possible explanation for the hypertensive effect. Of magnesium in pregnancy is fairly common, with some 20% of pregnant women deficient. This can cause the uterus to be more excitable and make preterm labor more common. In these cases, giving the magnesium can stop the premature labor. High doses of magnesium sulfate may be able to stop uterine contractions even in women who are not deficient. At least one analysis of available data indicated that magnesium sulfate was not useful for this purpose and might cause more fatal death. A more recent review concluded that magnesium sulfate given to the women at risk of preterm birth can protect the baby's brain. This is also speculation that low levels of maternal magnesium can contribute to the congenital birth defects as well as sudden infant death syndrome. Preeclampsia is a condition of the last trimester of pregnancy that includes high blood pressure, protein in the urine, and swelling of the feet and hands. Untreated preeclampsia can progress to eclampsia with seizures and coma. Magnesium supplement is used to prevent and treat the seizures in pregnant women with preeclampsia and eclampsia.
There is a relationship between magnesium and blood pressure. Low levels of the mineral are associated with type 2 diabetes. Type 2 diabetes, which is also known as adult onset diabetes, occurs when the body cannot use insulin properly, usually in obese people. It is not known if the low magnesium levels make the diabetes worse or if the diabetes causes the low magnesium levels. Low magnesium definitely can make insulin resistance worse, which can make blood sugar harder to control. Elevated blood sugar can cause more magnesium to be lost in the urine, leading to low magnesium level. There is some evidence that supplemental magnesium can improve control of diabetes in older people. The Iowa Women's Health Study and the Women's Health Study came to similar conclusion, found no relationship between magnesium intake and diabetes. There have been some small prospective studies giving diabetic supplemental magnesium. There was improvement in diabetic control in one such study and no effect in another study. There is no definitive proof that giving supplemental magnesium to diabetic patients who are not actually low on magnesium will be of benefit. There is some limited evidence that magnesium supplementation might improve the pain of peripheral neuropathy in diabetes. Magnesium has been used both by vein and by inhalation for acute asthma attacks in emergency room settings. Results have shown benefits to using intravenous magnesium for children. There is less evidence for the effectiveness of magnesium in adults. There thus seems to be some benefits to magnesium given by inhalation. The improvements are reflected as lower hospital admissions rates and improve the lung function for those treated. In these cases, magnesium is used in addition to all the standard hospital room care of severe asthma. There is some evidence that giving children magnesium supplements on a daily basis can lessen the frequency of asthma attacks. There have been many epidemiologic studies that correlate high intake of magnesium with lower blood pressure, including the Dietary Approaches to Stop Hypertension study in the late 1990s. High blood pressure has indicated that magnesium-rich diets are good for people with the hypertension or those at risk for it. It is possible to separate the magnesium from the other elements in the diet when looking at the observational studies. Prospective trials are needed to determine whether or not people given supplemental magnesium will be less likely to develop high blood pressure. There is evidence from animal studies that lowered magnesium levels can contribute to heart damage and heart failure. There is also a cardiomyopathy associated with the genetic condition of low magnesium called hereditary hypomagnesemia. Magnesium given by vein is one way to prevent the heart arrhythmias, called atrial fibrillation, from occurring during the heart surgery. Low magnesium level is associated with high rate of coronary artery diseases. Using of supplementation show a potential benefit to taking the magnesium as far as heart health is concerned. There is some evidence that higher level of dietary magnesium can decrease the risk of stroke. Magnesium can also be used in a specific way to help manage a stroke. When a person has a stroke from lack of blood flow, protecting the brain tissues until the blood flow can be improved can be limit the extent of the damage. This is called neuroprotection. The earlier it can be started, the better. There has been enough success with early studies using the magnesium as a neuroprotector to warrant a large trial. Magnesium may work best along with hypothermia in stroke neuroprotection. Some believe slightly cooling the person as well as giving the magnesium will protect the brain better. Magnesium is involved in hundreds of the human body's biochemical and metabolic reactions. Magnesium is distributed throughout the body. Half of the magnesium is in bones, 25% is in muscles, and 19% is in heart and liver. Most of the magnesium found inside cells is bound to other chemical compounds, including nucleic acid, ATP and ATP and proteins. 90% is bound to compound or structures made from these building blocks. Magnesium helps stabilize proteins, nucleic acid, and cell membranes. The small amount of free magnesium inside cell ensures that there will be enough magnesium when needed. Magnesium is involved in the flux of molecules through membrane. It has an effect on various brain receptors that are involved with mood. Adequate levels of magnesium are necessary for the normal regulation of many hormonal systems. For example, the complex relationship of hormones and minerals that manage the bone structure and density. Parathyroid hormone stimulates the absorption of magnesium from the intestine and kidney, as well as the release of magnesium from bone. Magnesium affects the parathyroid glands and the action of vitamin D. There is an important complex relationship between calcium and magnesium level. Magnesium is also found in the blood in the serum protein and in red blood cells. Some of it is bound and some is free. There is a balance between magnesium in the blood and the central nervous system that is maintained by an active transport mechanism. The mechanism at the blood-brain barrier serves to keep the amount of magnesium in the brain up even if there is a generally low level in the blood. When extra magnesium is given by the vein, it gets rapidly into the fluid around the brain at higher level than the blood. The amount of the magnesium getting through the blood-brain barrier may change as the result of the seizure activity. After a seizure occurs, more magnesium may be able to enter the brain, where it acts to prevent the more seizures. Magnesium sulfate is used to prevent the seizures in women with the preeclampsia and to treat the seizures in pregnant women with eclampsia. Magnesium sulfate is a vasodilator. It can cause the relaxation of blood vessel walls. Magnesium does this by acting as a calcium antagonist, acting on calcium channels in smooth muscles. Magnesium sulfate may lower the blood pressure and the resistance of the blood vessels. This is the reason that it is thought to reduce the seizures in eclampsia, not because it causes the vasodilation in the brain. Many people do not get the recommended amount of the magnesium in their diets. Deficiency is unusual in otherwise healthy individuals. The kidneys are able to retain the magnesium when it is needed, and the healthy intestine can absorb the necessary amount. Low magnesium levels can occur because of impaired absorption as the result of any illness that damage the intestine tract. Examples include Crohn's disease, gluten-sensitive enteropathy, and the renal inflammation in the intestine. Intestinal surgery may remove the rinds needed for the magnesium absorption. Magnesium can also be lost during prolonged vomiting and diarrhea. Magnesium can be lost in the urine because of diabetes and also the use of certain medications. Medications that can cause the magnesium loss in the urine are in the general categories of diuretics, antibiotics, and drugs used to treat the cancer. The cancer-treating medicines cisplatin causes the magnesium loss, as do the antibiotics. These two antibiotics are not in common use. Low magnesium can occur after severe burns or surgery. Symptoms of magnesium deficiency include loss of appetite, nausea, and vomiting. Other symptoms are weakness and fatigue. Low levels can lead to the personality changes, seizures, muscle cramps, twitching, tingling, and numbness. With lower levels, abnormal rhythms of the heart and spasm of the coronary arteries can occur. With severe deficiency, muscle spasm can be unrelenting, heart rhythms may be abnormal, and a person can have hallucination. Blood tests to measure the magnesium do not always reflect the amount of magnesium in the body and miss many cases of the lower magnesium. The best test may be a magnesium challenge test in which magnesium is administered and urinary and blood levels then measured. Magnesium levels in the red blood cells and better reflect the magnesium status. Low levels of magnesium are often associated with low levels of calcium as well as potassium in the blood. Magnesium is absorbed by the small intestine. It leaves the body through the kidneys. Magnesium is in chlorophyll found in all plants. Green vegetables are good sources of magnesium. Magnesium can also be found in some nuts, seeds, legumes, fruits, and unrefined grains. The content of magnesium in water depends on the sources. Hard water, which contains the minerals, usually has magnesium in it. Other sources of magnesium include certain fish, dairy products, raisins, and bananas. Some examples are one serving of the frozen cooked spinach has 75 mg of magnesium. 1 ounces of dry roasted almonds has 80 mg. One baked potato with the skin has 50 mg. 2 tablespoons of wheat bran have 45 mg. One serving of brown long grain rice has 40 mg. One banana has 30 mg and 1 cup of reduced or fat-free milk has 27 mg of the magnesium. Magnesium sulfate is used to prevent and control the seizures in the pregnant women with preeclampsia. This is accepted practice, although the way in which magnesium sulfate works is not completely. Supplements may be useful for the people with asthma. Magnesium supplements should be given to anyone with a known or suspected deficiency. These were sent in 1999 by the Institute of Medicine. There were recommended dietary allowances set for all the groups except infants. The RDA is an amount sufficient for most healthy people. For 1 to 3 years old, the RDA is 80 mg per day. For 4 to 8 years old, the RDA is 130 mg per day. For those ages 9 to 13, it is 240 mg per day. For men ages 14 to 18, the RDA is 410 mg per day. This drops down to 400 mg for men ages 90 to 30. and goes up to 420 mg per day for the men ages 31 years and above. For women ages 14 to 18, the RDA is 360 mg per day. This drops down to 310 mg for the women ages 19 to 30 and goes up to 320 mg per day for women ages 31 years and above. Women ages 14 to 18 who are pregnant need 400 mg per day. They need 360 mg per day while breastfeeding. Women ages 19 to 30 who are pregnant need 350 mg per day. They need 310 mg per day while breastfeeding. Women over 31 years of age who are pregnant need 360 mg per day and 320 mg per day while breastfeeding. There is no difference in magnesium RDS for breastfeeding women as opposed to non-pregnant women of the same age. For infants, the average intake is 30 mg per day for ages 0 to 6 months and 75 mg per day for ages 7 to 12 months. When people are slightly low on magnesium, oral supplements can help. The amount of elemental magnesium varies depending on what it is combined with. Magnesium carbonate is 45% magnesium. Magnesium citrate is 16% magnesium. The amount of magnesium absorbed by the body also has to do with the preparation of the supplement. Both low and high magnesium levels can be dangerous. Normal amounts of magnesium in supplements and food are very safe. Magnesium excess can cause diarrhea and cramping. This is more risk of toxicity in the people with kidney failure who cannot eliminate enough magnesium. High magnesium level can cause other symptoms somewhat similar to low magnesium levels such as weakness, nausea, loss of appetite, and a change in personality. Trouble breathing, low blood pressure, and the irregular heartbeat occur with low magnesium levels and not high levels. Very high magnesium levels can cause death. This may happen to elder individuals taking the constipation medicines or antacids that contain the magnesium. If their kidney function is deteriorating, magnesium levels can rise. Routine blood tests are not usually done to check magnesium and are not accurate. Magnesium is present in many laxatives and antacids. It is important to be aware of how much magnesium is any of these over-the-counter preparations.